11 signs which your body gives you a month before a heart attack. A heart attack, also called a myocardial infarction, can be fatal. According to the United States Centers for Disease Control and Prevention, CDC, about 659,000 people in the United States die from heart disease each year. That's 1 in every 4 deaths. A heart attack occurs when the flow of blood to the heart is blocked. The buildup of fat, cholesterol, and other substances in the arteries that feed the heart, coronary arteries, form a plaque. Over time, the buildup of fatty deposits, including cholesterol, can narrow the arteries. This slow process is known as atherosclerosis. This condition, called coronary artery disease, causes most heart attacks. The plaques cause a blockage to the flow of blood. During a heart attack, a plaque can rupture and spill cholesterol and other substances into the bloodstream. A blood clot forms at the site of the rupture. If the clot is large, it can block blood flow through the coronary artery, starving the heart of oxygen and nutrients, ischemia. The interrupted blood flow can damage or destroy part of the heart muscle. Heart attack, or myocardial infarction, is not an ailment that occurs overnight. It develops slowly as the supply of blood to the heart tissue is gradually restricted and eventually cut off entirely due to deposition of fat and cholesterol inside the coronary arteries. Medical research has shown that, like all other diseases, heart attacks also have early signs and symptoms, which, if recognized in time, can help stop the progress of the ailment before it inflicts any irreversible damage. According to the Society of Cardiovascular Patient Care, data analytics show that over 50% of the total patients who suffer from myocardial infarction have early symptoms of the disease and could be saved from permanent damage if provided with early heart attack care, EHAC. But what are these early signs and what can you do to help prevent a heart attack? In this video, we are going to answer these questions, so make sure to stay tuned. And if you are new to this channel, make sure to subscribe and hit the bell icon. Symptoms of a heart attack can vary depending upon gender and age of the patient, as well as the type of heart disease they have. It can also vary in terms of severity of the symptoms. Some people may have more severe pain and others only have mild pain. Some people have no symptoms. For some, the first sign may be a sudden cardiac arrest. Therefore, the symptoms may vary from case to case, and the sooner they are detected, the greater the chances of a full recovery. Some heart attacks strike suddenly, but many people have heart attack warning signs and symptoms that surface about a month before it happens. It is therefore very important for us to acknowledge them and take action. It could save our lives. Without a proper functioning heart, there is no life. A heart attack can be prevented. Here are the most common symptoms to look out for. Number 1. Chest pain. According to the American Heart Association, AHA, the first symptom of a heart attack is an uncomfortable pressure, squeezing, fullness, or pain in the center of your chest. It is called angina. Angina is chest pain or discomfort caused when your heart muscle does not get enough oxygen-rich blood. The pain or discomfort may come in waves lasting more than a few minutes at a time. The angina pain may even feel like indigestion. Hence, many people ignore this symptom because they think it is indigestion. Angina is a symptom of an underlying heart problem, usually coronary heart disease. Please note, heart attacks can occur without chest pain. Nearly half of the people who suffered a heart attack reported no experience of angina. This is particularly true for people with diabetes, who often have nerve damage and therefore may be less sensitive to this pain. Enjoy the video, then give it a like and share it with your friends. This will help the channel. Number 2. Upper body pain. The pain or discomfort may not be restricted to the chest only. This discomfort also can occur in your shoulders, arms, neck, jaw, or back, states the American Heart Association. You may have upper body pain with no chest discomfort. This pain is not sharp, but rather gives off an aching sensation of heaviness or even numbness. Number 3. Stomach pain. The pain may extend downward into your abdominal area and may feel like heartburn. Number 4. Dizziness. We may feel dizzy if we are not drinking enough water, skipping lunch, or standing up too fast. However, if you feel dizzy or lightheadedness coupled with chest pain and shortness of breath, then it may be a sign that you are in some danger. It may signify a decrease in blood volume and a drop in blood pressure, signaling to you that a heart attack could be on its way. When your body has poor blood circulation, your brain will not receive the proper blood flow required to function properly. If the dizziness does not subside, seek medical attention immediately. Number 5. Chronic fatigue. If you feel tired and sluggish constantly, then it is a cause for concern. This may signal a reduced blood flow to your heart due to a large buildup of plaque in the arteries that carry blood to and from the heart. An insufficient supply of blood, and by implication, of oxygen and nutrients to the body tissue due to the weakened heart muscle cause you to feel tired. The fatigue may come on suddenly and worsen over time. Women can feel fatigued a month before having a heart attack, according to Harvard Health Publishing. Seek medical attention immediately. Number 6. Shortness of breath. If walking up the stairs used to be a breeze, but of late you find it harder to make the climb, and you need to stop to take a breath, then it could be a sign that your heart is in danger. When your body does not receive sufficient blood, the lungs will also be affected. Breathing and blood circulation are inextricably linked processes. Blood is pumped by your heart so that it may get oxygen from your lungs, and then circulate the oxygenated blood to your tissues. You may experience shortness of breath when your heart is unable to pump blood effectively. Do note that shortness of breath can also come on suddenly, even while you're at rest. This is because your arteries are blocked and your heart may not be able to pump enough blood through your lungs quickly enough to be oxygenated. According to the American Health Association, shortness of breath could come with or without any chest pain. Number 7. Flu-like symptoms. An impending heart attack may give you flu-like symptoms. You will have fever, feel fatigued accompanied with chest pain. These symptoms can last between 2 and 10 days. If these symptoms persist after a few days and do not go away, then it is advisable to see a doctor immediately. However, it should be noted that if you have a cold or flu, it does not mean you are in danger of getting a heart attack, but you should monitor the symptoms. Number 8. Cold sweat. Sweating is healthy during physical exertion/activity or in hot weather. However, when you begin perspiring while experiencing discomfort in your chest, arm, neck, or jaw with little or no exertion, it could be the onset of a heart attack, according to a study at the University of Illinois at Chicago. The chest discomfort and reduced blood pressure may trigger your nervous system to respond with a drenching sweat. Your skin also may become cold and clammy. Number 9. Nausea and vomiting. When your heart is not functioning properly, the blood flow to the digestive tract may be affected. You may experience gastrointestinal cramps and nausea. Vomiting or digestive sensitivity coupled with cold sweats and dizziness may signal that your arteries are clogged that may result in a heart attack over time. Number 10. Anxiety. You may feel as if you're having a panic attack for no apparent reason. Anxiety has been linked to the onset and development of cardiovascular disease, like coronary artery disease, CAD, in some cases. Anxiety can result in tachycardia, a condition characterized by abnormally rapid heart rate, and though it has not been observed to directly cause hypertension, it can lead to high blood pressure. Persistent anxiety may put greater strain on the heart, which might be harmful to someone who already has a cardiac problem. Number 11. Heart palpitations. You may feel as if your heart is skipping beats, or you may just be very aware that your heart is beating. Although heart palpitations can be worrisome, they're usually harmless. In rare cases, they can be a symptom of a more serious heart condition, such as an irregular heartbeat, arrhythmia, that might require treatment. However, seek emergency medical attention if heart palpitations are accompanied by chest discomfort or pain, fainting, severe shortness of breath, severe dizziness. Important advice. Whether your symptoms seem obvious or are more subtle, take them seriously and get medical care. Enjoy the video. Do share your experience if you have any of the symptoms of heart attack in the comments section below. We love to hear from you. And if you liked this video, then make sure to click the like button and subscribe to the channel so that we can keep coming up with your favorite content.